This video is going to be on platelet disorders. Platelet disorders are grouped into 3 categories. The first is thrombopathy, which is a functional platelet defect. The second is thrombocytopenia, which is a decreased platelet concentration. And the third is thrombocytosis, which is an increased platelet concentration. This video is going to focus on thrombopathy, which is a functional platelet defect. Von Willebrand disease is an excellent example of a thrombopathy. This is when von Willebrand factor is either defective or deficient. So platelets cannot bind von Willebrand factor to stop bleeding. Glanzmann thrombocythemia is another example of a thrombopathy. This is when the platelet receptors for fibrinogen are either defective or absent. There are lots of different drugs that can cause thrombopathy and inhibit platelet function. COX inhibitors are an excellent example of this type of drug. The rest of this video is going to focus on von Willebrand disease. Von Willebrand disease is typically seen in dogs, less commonly to rarely in other species. And this is an inherited disease, so you tend to see clinical signs in young animals. And those clinical signs that you see are hemorrhage. The hemorrhage that you tend to see are bleeding from mucosal surfaces or excessive hemorrhage after surgery, so after castration, after spay. But other clinical signs of hemorrhage include epistaxis, meaning bleeding from the nose, gingival hemorrhage, hematuria or bloody urine, vaginal hemorrhage during estrus or postpartum, and gastrointestinal bleeding. These animals tend to very rarely have petechiation, hemarthrosis, or hematoma formation. So now I'm going to go into the testing that we would expect to see in an animal with von Willebrand disease. So first, platelet concentration tends to be normal or increased. You do not expect to see a marked thrombocytopenia. So you do not expect to see platelets that are within the realm that induces spontaneous or induced hemorrhage. So tend to see platelets normal or increased, but certainly greater than 50,000 per microliter. You also expect to see normal tests of secondary hemostasis. Those secondary hemostasis tests are PT and PTT, and you'll learn more about those tests in subsequent videos. There is an in-house test, an in-house screening test you can do for functional defects, so thrombopathy, and this is called the buccal mucosal bleeding time. You essentially use this small handheld instrument to make an incision, a very superficial incision into the mucosa, and you monitor how long it takes for that incision to stop bleeding. In patients with thrombopathy or thrombocytopenia, this buccal mucosal bleeding time will be prolonged, so it'll take longer for those animals to stop the hemorrhage. Now, this is a very crude test because it does depend on the position of the animal, whether or not the animal moves, and then also who's actually implementing the test. So there can be variability from one person to the next as far as actually performing this test. So it's nice because it is a screening test and you can do it in clinic, but if you want to confirm a diagnosis of von Willebrand disease, then you have to do a send-out test to actually measure von Willebrand factor. And you can measure the quantity and the function through various different tests. Okay, so that's it for this video. The next video will pick up with thrombocytopenia.